So I'm Hamid Noori. I'm co-founder and CTO of Before Health Intelligence, and I'm going to introduce to you the Anstrike. Anstrike is an embedded AI platform for preventive just-in-time warnings for heart attack and stroke, as well as also diseases beyond that. Essentially, Anstrike is a real-time risk calculation algorithm that provides also health advices ahead of time. It is comprised of two AI elements, two AI layers: a static AI core that has been trained on data from approximately 125,000 individuals, and a dynamic AI core that uses real-time sensor measurements from commercially available smartwatches. The dynamic AI element has been trained on over 130 billion preclinical data points, and thus far on over 1.5 billion clinical data points. And we are expanding that to 77 billion in interaction with Stanford Medical School to prepare for also FDA approvals for these settings. So essentially, what it does and what it provides, in contrast to the existing technologies, is that it predicts catastrophic and non-catastrophic conditions and health events with a high temporal accuracy. So for the vast majority of diseases that we looked at, above 85%. Depending on the disease that we are looking at, this translates to being able to predict the onset of a condition a couple of hours to up to 5 days ahead of time. That would apply for a heart attack. The main advantage is that, in contrast to the current state of the art, we do not rely for the data extraction on expensive and heavily calibrated clinical equipment, but rather can work with commonly used smartwatch data. And another element is that it actually monitors and processes data passively. And so it does not interrupt the daily life, daily routines, and habits of the individuals using this technology. Our business model is entirely B2B. We provide this algorithm as an integrated algorithmic solutions so far primarily for tech companies. We have major traction from, I would say, the top 10 tech companies in the world, numerous contracts signed. Unfortunately, I cannot name a single one of them. But what we provide is the algorithm integrated into their existing platforms for them to provide it for their customers. The range of companies, and I apologize for the PDF just jumping, the range of companies that typically fall within the customer base of our company are sensor manufacturers, smartphone and wearable manufacturers like software companies, but also insurance companies and healthcare providers. And the key factor here is that the use cases of our algorithm go far beyond the cardiovascular diseases for which the algorithms were originally developed, but nowadays they can also work on known critical conditions that can actually have fundamentally different use cases. We see a use in employee management, particularly when the algorithms are trained for non-catastrophic scenarios, for instance, such as common cold or more seasonal diseases. It can support workforce management and work time disruption predictions. But we see also applications in the domain of safety in transportation industry, as well as also supporting the aging population. And what we are currently looking for is essentially expanding the range of applications that we have and co-development with primarily pharmaceutical and personal care companies, because we see a high chance to use this technology also for identifying the optimal instances for drug administrations, as well as also predicting more in a personalized manner the effects and side effects of particular drugs, and also the right moment for application of certain personal care topics. I will look forward to any questions as well as also collaborations that may arise from this. Thank you.